Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action.
Good morning, good afternoon, good evening for everyone who is listening to this podcast. My name is Eszter Kismödi. I am the Chief Executive of Sexual and Reproductive Health Matters, and I'm extremely pleased to welcome today in this podcast Dr. Faysal El Kak, who is the Associate Professor of Clinical OBGYN, Sexual Health and Public Health Practice, and Director of Women Integrated Sexual Health, WISH program at the American University of Beirut, our distinguished member of our SRHM editorial advisory board and collaborator for our Middle East program for SRHM. Such a warm welcome for you, Faysal, for this podcast discussion as the new president of the World Association of Sexual Health WAS.
Thank you very much. Thank you very much, Eszter, and thank you for having me in this one of the important series that you do, the podcast, as part of the advocacy and work of SRHM.
Thank you. So I really would like to talk to you today about starting your presidency at the World Association of Sexual Health. WAS is just coming out of its most recent congress in Brisbane, Australia, where the vision, strategy, new governance of WAS has been discussed, announced, and you have been elected as the new president. Really, congratulations for that.
Thank you. Thank you very much.
As my first question before this, as a first question before I would like to talk to you about WAS specifically, that your presidency is starting in a very, very critical time for sexual health rights and justice. So just situate when you start your presidency. You are coming from Lebanon that is in and out of war. There are many other countries. There is a new US administration that are destroying the role of science, budgets, programmatic work, directly attacking LGBTI, abortion, and other sexual health-related topics. How do you see the context of sexual health where your presidency is starting?
Thank you. As you have just said, these are tough times, and we are living in an extraordinary complexities, especially for sexual health. There is a lot of challenges, but at the same time, there is a lot of opportunities. On one hand, we're seeing more bold youth movements. We're having more bold agencies moving around SRHR. Voices are heard. We're moving toward the SDG 2030 in a progressive way as much as we can moving forward. But at the same time, there are challenges, as I have said, that's going to face WAS, that's going to face SRHM and all of us, which is the rise of the conservatism, the anti-rights movement. We also have to deal with challenges related to economic pressures, shortage of funds, the whole political economic context, and the impact of the geopolitics that's affecting SRHR, the displacement, the refugees, and the whole impact of this on people, especially on women and young girls. And also, and most pressing, is also this whole digital gap, in addition to disinformation and misinformation that's facing all of us, especially the young people. So what I see are challenges that have political and economic dimension, and others that have more of a digital / kind of information and also knowledge dimension, in addition to the existing population issues that you have to deal with. So it's a kind of a multi-layered, compounded crisis sort of that we have to face. But as I said, at the same time, you have, I see better activism going around. I see more people joining hands and collaborating. I see more global educational platforms that's being of help to a lot of people. There is more science that's being produced, linking sexual health to the life course, linking sexual health to the well-being. And you remember, Eszter, we've been together in this whole exercise of putting sexual health across the life cycle, of linking sexual health to wellness and well-being, and to human rights, of course, at the same time. And there is also this opportunity of having more intersectional approaches to what we're doing nowadays, linking sexual health to life course, to the economic dimension, to the well-being dimension, to the public health dimension, and most importantly, to gender equity and mental health. So all these are encouraging for us. Yeah.
I am extremely pleased to be in the executive committee of WAS and being the chair of the Sexual Rights Committee during your presidency. How do you see the role of WAS? What is your strategic vision for WAS for your presidency and the coming couple of years?
You see, for me, simply, was starting from a place, at least to me, that sexual health is not a luxury. And sexual health is a fundamental part of the human dignity and overall health and well-being. So that's a given. So if you're going back to the WAS mandate, we can understand that it is a global umbrella. For me, it's a global voice. It's a strong engine, so to speak, that's able to unite, gather so many individuals, so many organizations, and bring in other sister organizations to really synergize and move forward to protect and to promote sexual health, sexuality, and sexual rights.
And how do you see it? There are international organizations, there are regional organizations, there are NGOs working on sexual and reproductive health, research institutions, WHO. How do you see WAS specific leadership role in the area of sexual health?
Probably I think is the only one, or one of the very few, that has a strong convening power to bring people together. Was also at the same time, and I'm sure you know that very well, is one of the few that's able to come up with declarations, come up with statements that not only inform and guide global policies, but also links policies to programs and links programs to activities that takes care of services, that takes care of education, that inform health system, and also services for sexual health and for research, and definitely inform advocacy.
So just staying on the convening power, can we talk very briefly about WAS' latest pretty bold initiative that will start and will be convened on World Sexual Health Day this year on the 4th and 5th of September in the form of a World Sexual Health Assembly. Can you talk about this initiative?
Well, I'm glad you brought this up, and I'm glad you are part of the steering committee of this global initiative. This is something at the core and at the heart of what WAS is doing, is to convene major and influential agencies and organizations together in this global assembly to protect and promote sexual health and well-being. I mean, it is a spontaneous thing. It's an obvious thing that WAS, in these difficult times, should move forward to promote and protect sexuality and sexual health and rights, and bring all those concerned people to this assembly. This assembly, you just mentioned, will be about bringing the people together, to think together, to discuss together, to debate together as organizations, as institutions, as international UN agencies, as funders, as major players, academicians, researchers, and many others. Also like journals like yours, to think together about what exactly is at stake here and what we can do about it and in what ways. And this is the first thing that's going to happen, at least for the coming 5 years. You have some kind of a roadmap, not only every organization alone, but all these collective organizations, institutions will be at least talking to each other when they are doing their work and their effort, and they feel that there is so much solidarity among different organizations in different contexts, academic research, science, whatever, publications, UN, non-UN, and it will definitely give a great push in that endeavor of protecting and promoting sexual health and rights. I would say sexual reproductive health and rights also.
Thank you very much, Faysal. It sounds absolutely fantastic. Once again, really sincere congratulations for being elected as a president. I'm personally really looking forward to continue to work with you. And SRHM is very dedicated to work with WAS as it has been done in the past, in the future as well. Thank you very much, Faysal.
Thank you very much.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.